The College of the Registered Nurses of Saskatchewan acknowledges that our registrants and the public we serve reside on the traditional lands of the Plains Cree, Saulteaux, Assiniboine, Sioux, and Dene Chipewyan peoples, and the traditional homeland of the Métis Michif Nation. We are honored to live and work on Treaty 2, 4, 5, 6, 8, and 10 territories. We respect and honor the treaties that were made on all territories. We acknowledge the harms and mistakes of the past, and we are committed to moving forward in partnership with Indigenous peoples in the spirit of reconciliation and collaboration. We are all treaty people. Hi, I'm Virginia Diebold, a registered nurse and a practice and education advisor with the College of Registered Nurses of Saskatchewan. As part of the confirmation of nursing practice process, I often speak with registrants who spent most of their careers in traditional healthcare settings like the Saskatchewan Health Authority. In these environments, many of the legal, regulatory, and operational considerations are built into the system and supported by teams like risk management, infection control, and nurse educators. In hospital settings, we often have access to teams of experts and specialists who help ensure compliance with legislation, policies and procedures, reporting structures, and evidence-based practices. This support helps nurses adhere to legislative requirements, work within our scope, maintain our competencies, and protect both ourselves and the public. However, in non-traditional employment settings, these supports may not be readily available. That's why it's critical to understand and take ownership of the full scope of your responsibilities before you provide nursing services to a client. Here are just some of the key areas to be aware of: legal risks and liability protection, provincial and federal legislation, privacy legislation and secure record keeping, infection prevention and control, product and supply regulations, both federal and provincial, and professional standards and regulatory expectations. To help you navigate these responsibilities, we've developed this video to walk through the important considerations tied to the attestation form. As I speak, you'll hear references to a number of key documents and resources. When I refer to CRNS foundational documents, I'm referring to the CRNS entry-level competencies, practice standards, the CNA Code of Ethics for Registered Nurses 2017, the CRNS bylaws, and the Registered Nurses Act 1988. As a reminder, it is the registrant's responsibility to ensure they are using current documents, guidelines, and relevant legislation. Please check the CRNS website to access the most current resources that are in effect. While we see more RNs and NPs entering non-traditional roles or embarking on new and innovative ways to practice nursing, it's important to be knowledgeable and stay aware of current guidelines, resources, and legislation that applies to all aspects of your practice. These resources are online at www.crns.ca under the Practice and Education tab. Another helpful resource is the CRNS Scope of Practice tool, which provides a step-by-step process and links to the internal and external resources you may need when confirming your scope of practice. Our goal is to support you in delivering safe, ethical, and competent care no matter the setting you practice in. Thank you for watching this video to gain an understanding of the requirements within the confirmation of nursing practice process. Whether you are employed by an organization or working in independent practice, it is critical to assess the level of risk in your practice and ensure you have the appropriate layers of legal protection. In more traditional settings, like hospitals, many legal safeguards are built into the workplace to mitigate risk, such as insurance coverage, dedicated policy and procedure writers, risk management teams, infection prevention and control departments, OH&S committees, and nurse educators. These structures help to protect both the client and healthcare professional by aligning safe care and delivery with legal and regulatory requirements in that practice setting. When we step outside that traditional established setting, we may need to ask a few questions to ensure we have adequate coverage for both RNs and NPs and our clients, depending on the practice setting and the level of risk involved. Do I have the right type and amount of liability protection? What risk does my practice setting present? Who is responsible if something goes wrong? You may not have considered needing additional liability protection before, but in certain settings and contexts, risk is higher and you may benefit from having additional protection. The Canadian Nurses Protective Society, CNPS, is an independent, not-for-profit organization that provides professional liability protection specifically for nurses. As a registrant with the CRNS, you already have basic CNPS coverage included with your licensure. This protection includes access to legal advisors and financial coverage if you are ever deemed individually responsible. However, if you operate independently, we strongly advise consulting with a business lawyer before starting your practice and determine the level of liability risk associated and what personal, professional, or business liability insurance you might need. Business insurance is different from liability protection. Liability protection covers you as an individual nurse. Business insurance provides comprehensive coverage for the business, including if your business is named in a legal action or if confidential information is accessed inappropriately. Whether you're working in traditional employment or an independent practice, understanding and securing appropriate coverage is your professional responsibility. For personalized advice, contact CNPS directly or visit their website to explore your options. When managing patient health records, there are strict legal obligations and privacy expectations you must meet. In nursing practice, you must have an appropriate documentation process in place that meets the Health Information Protection Act, otherwise known as HIPAA, requirements around collecting, using, and disclosing personal health information per provincial and federal regulations, meets the Personal Information and Protection and Electronic Documents Act, PIPEDA, requirements about collection, storage, retention, and disposal per provincial and federal regulations. Informed consent is documented and includes how information is being collected, used, disclosed, details of procedures, possible outcomes including side effects, costs, and follow-up. Clear referral process to other healthcare professionals as required. How you document may vary depending on your practice setting, but regardless of the environment, you must adhere to the following: the CRNS practice standards, the Code of Ethics, the entry-level competencies, the documentation guideline, and any relevant provincial and federal legislation. As the RN or NP, you are ultimately responsible for your own practice, whether independent or employed. If you're entering a non-traditional role, speak with your employer to understand your legal responsibilities as a licensed RN or NP and confirm the proper processes are in place before you begin practice. For those self-employed in independent practice, the obligations around privacy and confidentiality shift entirely to you. This includes ensuring secure storage of patient health records, both physical and electronic, meeting legal requirements for retention and disposal of records, taking full ownership of privacy safeguards that may have been handled by your employer in the past. To meet your legal obligations, it is important to review both federal and provincial privacy legislation, understand and apply all relevant CRNS documents, visit the Office of the Saskatchewan Information and Privacy Commissioner for more information. Become familiar with the Canadian Intellectual Property Office depending on your practice. In nursing practice, authorization to perform a procedure or administer a medication involves more than just getting a signed order. If you're an RN performing services that require a physician's or nurse practitioner's order, you must obtain ongoing collaboration with the authorized provider and ensure clear, up-to-date policies and procedures are in place for safe delivery of care in your practice setting. To support your practice, review the Registered Nurse Specialty Practice Guideline, the RNSP. This document outlines how to develop and use RN protocols, ensure you have the proper authorization mechanisms in place, and stay aligned with regulatory standards. Did you know that if you're an independent practice, your responsibilities extend even further? Before offering certain products, treatments, or devices to your clients, you must verify whether their sale or use is permitted under provincial or federal legislation, and ensure the product or service is legally authorized for use in Canada. When it comes to policy development, RNs and NPs must ensure their practice aligns with legal and regulatory expectations at all times. This includes adhering to the Registered Nurses Act of 1988, the CRNS practice standards, the entry-level competencies, the CNA Code of Ethics 2017, and any other relevant guidelines or resources. If employed in a non-traditional setting, it is important to understand which policies and procedures already exist and, where necessary, work with your employer to develop policies and procedures that guide your RN and NP practice. Nursing policies should clearly outline things like the scope of services offered, how referrals are managed, quality monitoring mechanisms, advertising practices, how certification of competencies are achieved. Self-employed RNs and NPs are responsible for developing policy and procedure documents that direct both their nursing practice and business. The CRNS advises self-employed RNs and NPs to consult with a lawyer regarding business policy development for such things as the business budget, client accounts, billing, and the filing of tax forms. These aren't just administrative details, they are legal responsibilities that can directly impact the safety, accountability, and professionalism of your practice. As an RN or NP, every decision that you make in a practice setting must prioritize the best interest of the client, not your own. A conflict of interest occurs when your decision as a nurse benefits you more than it benefits the client, even if it is only perceived that way. This can occur in a variety of ways and may look different depending on the setting and context of practice. Examples include providing services to friends or family, promoting or selling products in a way that benefits you financially, or soliciting clients from your employed practice setting to use at your independent practice. In any setting, RNs and NPs must be aware of potential or actual conflicts of interest. No matter the practice setting, RNs and NPs should recognize actual or perceived conflicts of interest, disclose them to their employer, or document how they are identified and managed in independent practice. Always refer to another provider when appropriate, especially when caring for family or close friends. If you're engaged in independent practice while also employed, you are expected to inform your employer about your independent work, avoid soliciting clients from your employed setting, maintain professional boundaries, and never exploit any relationships for personal gain at the expense of the client. RNs and NPs must always adhere to the CNA Code of Ethics 2017, the CRNS practice standards, and any other foundational documents guiding nursing practice. When using your RN or NP title in any form of advertising, it's essential to understand the legal and ethical responsibilities that come with it. Registered nurse and nurse practitioners are protected titles and come with a different expectation and obligation than those without the title. Using your title lends credibility to a commercial product line, or healthcare service you promote. If you stand to gain financially or otherwise, you must be transparent, accurate, and clear about potential conflicts of interest in advertising or promoting your role of services. Advertising and endorsement must be presented so that it maintains the public's trust in nursing profession. Advertising is about providing the public with clear, factual information so they can make informed decisions about the care they receive from a self-employed RN or NP. Advertising of nursing services needs to be accurate, factual, and evidence-based, verifiable, ethical, and professional, and not induce services. When speaking with registrants, we've found that advertising in non-traditional nursing settings can be a new and sometimes challenging concept for many nurses. To put this into perspective, consider how it might look if a physician offered a 2-for-1 vasectomy, or if a nurse practitioner promoted 2-for-1 prescriptions. The same principles apply in nursing practice settings. As RNs and NPs, we provide nursing care by completing clinical assessments to determine next steps, not based on promotional sales. Advertising that suggests discounted or incentivized services can raise serious concern about professionalism and potential conflicts of interest. Instead, consider how public health communicates services like breastfeeding or immunization clinics or other nursing and medical services that are advertised to the public by the health regions. Whether you're self-employed or employed by a clinic, if your name and RN or NP title appear on any advertisement, including content created by a marketing team, you are responsible for ensuring it meets professional standards. All advertising must align with CRNS practice standards, the Code of Ethics, the Registered Nurses Act 1988, and all applicable provincial and federal advertising laws. If you're working in a non-traditional nurse practice setting, ask how your name and titles are being used. Make sure it's accurate, professional, and in line with your regulatory obligations, as well as federal and provincial legislation. The CRNS provides direction for RNs and NPs on what is expected from the regulatory body regarding advertising within the following resources: the Self-Employed Guideline, the Aesthetics Resource, and the CRNS Nursing Practice Updates. In addition to CRNS expectation, there are other laws and regulations to be considered, such as Health Canada regulations, general advertising standards and federal legislation, no matter which platform you're advertising on, website, social media, or print. The Canadian Code of Advertising Standards is a helpful resource and can be found here. Health Canada also offers valuable information regarding advertising drugs and medical devices, and we recommend visiting their website for accurate, up-to-date information. If you require further discussion or have questions, you can contact a CRNS Practice and Education Nursing Advisor by email at practiceadvice@crns.ca or by phone at 1-800-667-9945 or visit the website at crns.ca.